So, Bob, I have a couple emails here about sex.
Oh.
So let's read them and answer. What do you say?
I say, howdy, stranger. It's been a minute.
Middle tier patron Jocelyn, she says, because of my trauma history, I frequently experience sexual feelings when I feel safe. Or as Kirk described it in past episodes, I have feelings of sexual attraction that naturally flow from finally accessing feelings of safety and trust with somebody.
Yeah, right on.
I think that this sexual transference, as we might call it, can have a serious upside. Personally, the safety, sexy vibes clue me into something about the situation of feeling safe, which, because of past trauma, I'm not always easily able to detect. Maybe other people know feelings of safety through other cues, but this seems to be how my body responds to safety. My sexual transference can happen anywhere and anytime. It can happen with men and women of all shapes and sizes and doesn't actually conform to my usual sexual preferences or orientation. Bob, what do you think? Just chiming in.
I think this is lovely. A beautifully non-self-judgmental description and awareness of this thing that happens to you and a fearlessness about it. It's fantastic.
Yeah. Going on here. Recently, I felt sexual attraction to my personal trainer, who was not generally my type. But because she was reliably on time for our appointments and that she waited for me, I felt safe sexualness. Usually, I let these feelings play out in my mind and body, and they go away on their own after some time. I'm extra mindful whenever this comes up for me at the workplace, but other than that, I just take out these sexual feelings on my spouse or on my toys. Everybody wins in this context, LOL. So if anyone is out there struggling with the shame around these feelings, as I once did, it's possible that one day you will heal enough to befriend them. End of email, Jocelyn.
That's lovely.
No question, just putting it out there.
That's so cool. Thank you.
Another patron wrote in, anonymous patron, she says, it came out last week, my boyfriend has been cheating on me. Mm. And so he gave me permission to go through his devices. Mm. Bob's monologue about cheating and devices, I played my boyfriend this monologue, wow, which prompted him, my boyfriend, to give me permission to go through his devices. So thank you, Bob.
You're welcome. I'm so pleased.
What was your monologue?
I went on a rant like, give up your fucking device, your fucking privacy, blah, 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 blah. Yeah, no, I'm glad it helped.
Does it feel funny to think that the monologue, the rant, was used as a data point in an argument for gaining access to your spouse's devices?
It might on another day, but today it feels awesome.
Going on, the themes in his porn history, so she went through his devices.
Right.
The themes in his porn history, spanning over a year, the themes matched the two people he was cheating with. Their specific body type is very opposite of mine. Oh. So that's interesting. Bob, what do you think?
I think that he might be shame-based and confused or conflicted inside about his erotic self, and that there's a potential here for a lovely great deal of intimacy between them if they decide to work it through together. Mm-hmm. I mean, our bodies are our bodies, and we don't even choose what we're attracted to.
Yeah.
So I want to learn more.
Yeah. Well, why do you say shame-based?
Because he's hiding it.
Uh-huh.
And he's hiding his porn use, I presume. I think that's what I got.
Well, in the longer version of her email, she said that her and her boyfriend had a don't ask, don't tell policy about it. Oh. But she was totally fine with him looking at porn and masturbating, and thought it was fine for each of them to have a section of their sexuality to be private and by themselves.
Great.
So he was not necessarily actively hiding it. Do you know what I mean?
I do. Thank you. That's an important clarification.
Yeah. Could be that he was open to disclosing it if it came up. But it's notable that these two women, and in her longer email, which she didn't want me to read, she went into specifics as to what exactly she's referring to. She's trying to not be too disclosing.
Yeah.
But the body type is a category of porn that is particular, and it's the extreme opposite of her body type.
Right.
I don't know the percentage, not that it matters too much, but if you polled 100 people, I would say that a small percentage, not a super small, but like a small percentage of people would be into this sort of thing. So it's notable. And the two people that he cheated with were also of this body type.
Right.
So any thoughts on that?
That's what turns them on.
Yeah.
Yeah.
Okay.
Hey, I did want to go backwards a half step. They actually have an overt agreement about porn and masturbation. Most couples don't. It's fantastic.
Mm-hmm. Yeah. At the very least, beginning to develop an agreement, a conversation.
Right.
Some sort of understanding. And sometimes it doesn't have to be super overt. It can be something like, hey, you look at porn, right? And you masturbate sometimes, right? And the other person's like sheepishly might say, yeah. And that's kind of, and yeah, me too. And that's the extent.
Oh, that's a lovely agreement.
Right. It's not an agreement contractually.
No, it's not.
But it signals a lot of things of acceptance and acknowledgement. And
it circumscribes something about who we are as a couple. It's fantastic. I love it.
Now, I do think that optimally there are overt conversations, not only just to clear things up in case of misunderstanding and hurt feelings, but I think there's a lot of glory in that intimacy.
Oh, what a great way to put it.
With a partner,
Yeah.
The achievement of that safety in that space and just humanity. The way I think about it, it's like whatever fears we might have on my deathbed, am I going to be glad that I gave in to those fears? My entire life?
You will not.
My deathbed, am I going to be like, oh boy, I'm sure glad I avoided stretching my wings in that way, because I just really, I'm just so happy with myself that I avoided facing that fear and giving in to the Victorian and puritanical notions of my society. What a wonderful thing. I get it, but there's so much benefit when two people enter in, but it requires two people. Anyway, going on with the email.
Lovely.
I don't hold moralistic judgments about porn and have been careful not to shame him for using porn.
Oh.
But for some reason, I don't want him watching this type of porn anymore as a condition of us trying to repair from the cheating. Is this reasonable? I previously was fine with this porn use, but now it's different.
Yeah.
Do you have any thoughts on or guidance on this issue? End of email. I appreciate both Anonymous Patron and Jocelyn ending their email with end of email. They literally wrote that into their email.
What's good about that?
Because that's what I always say at the end of the email. Because like on TV, there will be a visual representation of the email, and you will see when the host switches from quoting to spouting.
Yeah.
On the podcast, we don't have that luxury. So I'm often saying things like chiming in here or getting back to the email or end of email, because I want people to know I'm reading something, not spouting.
Right. It's a signal.
Yeah. So Bob,
well done. Sophisticated emailing.
Is it reasonable for her to require or ask or semi-demand that her partner not watch this particular kind of porn?
Let me ask you, is it reasonable to laugh at a joke? Or do you just laugh?
Yeah.
You just laugh, right? What she's just telling us and what she's discovering is that right now, I don't know about tomorrow or next week, next year, maybe it'll be the same, but nonetheless, right now, that feels threatening. And I like that she's playing about it, at least with herself, and hopefully playing with her partner. And maybe they get to discover how the looking at that porn is related to the injury, the betrayal. If they heal the betrayal, who knows where they'll stand. But they are in each other's care. And I don't think we have a right to be vindictive assholes. But we do have an obligation to ourselves and our partner to be honest about where our pain is and what our need is. And in this case, give them a shot at helping her heal. So is it reasonable? Yeah, of course it is.
Yeah.
The reason I know it's reasonable is because she's telling us this is how she feels. And
Right.
she doesn't sound like an asshole.
Right. She is questioning, she's looking into it. She's trying to be self-aware.
Yeah.
She's coming at it from a lot of different angles.
Yeah.
And it doesn't seem like a knee-jerk reaction.
Do we consider the possibility that her partner is lucky? Like, this is a lovely partner being very earnest about an injury.
Yeah.
That guy's lucky.
Right. It's a small demand.
Yeah.
It's not a huge request.
Right.
So one way to look at it, anonymous patron, is that when it comes to the initial stages of infidelity repair, there will be perhaps some quote unquote unfair demands from the victim. I don't know if we'd say it's unfair, but they might be unfair if they were forever. But in the initial stages, like, for example, gaining access to your partner's phone, I think a lot of people would say, well, that doesn't seem fair forever, right? How long do you give access, especially if one person wants some privacy? You know, you are wanting to have private conversations with your mom just about things unrelated to your marriage or something.
Yeah, right.
Or you want to be able to browse porn and not be observed in your history, you know what I mean?
Yeah.
By your spouse.
Right.
Of course, Google's watching everything, but but you're entitled to wanting those boundaries for sure. But in the initial stages, if you screw up and you cheat, then concessions have to be made in the temporary to gain trust back so that those kinds of boundaries can be allowed or can be given without the victim feeling a persistent feeling of fear of what's he doing, what's she doing, you know. So to demand this or ask for this is one of those things.
Yeah.
In all likelihood, if repair actually happens, then in all likelihood, at some point, you'll be totally fine with him looking at whatever porn you want because you'll feel solid in your security with him and trust with him.
Yeah.
The other question, though, that has to do with the repair, I think, which is maybe the porn question is a symptom of this larger issue of, does he love you and is he attracted to you? Because that's a normal question, a normal series of questions to come up in your state. And to find this information, it raises these questions because you think, well, he's lied to me a lot before because cheating requires an infinite number of lies.
Oh, it does.
Especially by omission. Especially, I mean, particularly if it's ongoing.
Right.
In terms of like they cheated and then a number of months went by, they didn't tell you. But the question of, well, I don't know what he's telling me is truth or is deceptive. So when I find this information, is this evidence that he actually isn't attracted to me and we're not really made for each other? Because if that's true, whether he knows it or not, whether he's ready to admit that or not, that means that our relationship is doomed. No matter how much repair we do, he's going to cheat on me again because he's oriented towards a different sort of person than I am.
Right.
And that's a question that has to be explored thoroughly.
I don't know that it's inevitable that he'll cheat again, but there'll be this thing in their relationship, like one where there's, some kind of unaddressed longing or pain or a doubt in the part of, in this case, her about, are we a match?
Right.
Yeah. So, but it'll be there, whether it gets acted on or not, it'll just be there.
Right. So those are all things to do in couple therapy.
Yeah.
Because
agreed.
Without that, it's going to be really hard to navigate these waters. And if I take sort of a 10,000 foot view on your email, is that the phrase?
10,000 foot? Yeah, view? I use that all the time.
Is it always 10,000?
Yeah, I don't know why. Yeah.
Okay. Well, good. I'm glad because I'm bad with idioms, as everyone knows. But the 10,000 foot view that I have is, it seems like you, anonymous patron, might do good to yourself by valuing your own needs. In this state, having been cheated on, for your question, and maybe it's just one of 1,000 questions you have,
right?
But if your question is focused on, I don't want to impinge on his rights or something, instead of how am I going to, regain trust and love and security. And if you're not focusing on that, I recommend that you do, of course.
Yeah.
Because avoiding it won't make it better. You know what I mean?
Right.
But repair is absolutely possible, particularly given what Bob is saying, that you're not an asshole. That'll help.
Yeah.
Let's take a break. We get back. More emails. What do you say?
Hey, we're doing good.
All right, we're back from the break. So this email is from patron Al from Boston. Al, you don't hear my dad's name is Al.
Oh, my writing teacher's called Al.
My dad's name is Alan, but he goes by Al.
Al. Everybody calls him Al. Al's awesome. I like Al.
Is he an older fella?
No, he's my age.
We're older fellas.
Oh, then yes. No, he's my age. No, he's my age.
I doubt there's a lot of kindergartners named Al.
Yeah.
You know?
Though if there were, it would be so cool.
I know. He says, I've been seeing my therapist via telehealth services for 2 years. During my last session, my therapist informed me she would be leaving the provider in 3 weeks' time, and we made plans to discuss my options during my next session. So just chiming in here, reading the rest of the email earlier, I think what he's saying is that he goes to a therapist at an agency of some sort.
Oh, okay.
And that the agency is, the therapist, she's leaving that agency.
Right.
And so he had to transition and terminate and couldn't follow her for whatever reason. Anyway, in preparation for this life change, so again, 2 years of therapy.
Right.
In preparation for this life change, I recently watched your video titled Saying Goodbye to Your Therapist.
Oh.
I really liked the concept of getting closure, specifically with the opportunity to say goodbye. Yeah. So thank you for that. Unfortunately, the next week's appointment came, and I was informed that the therapist was already gone.
Whoa.
I have no idea why this occurred. I wasn't given any information other than my account being handed off to another therapist. This blindsided me, and I feel most unfortunate to have been robbed of the opportunity to get closure. Yeah. My message to everybody, tell your therapist how grateful you are for the work you've done together, and don't wait to say goodbye to do so.
Oh, yeah.
Which is nice. But what I would say is, Al from Boston, that this is pretty rare that a therapist would end up terminating either at their own behest or at the behest of someone else. It's pretty rare that this would happen. Plus, there's nothing barring the therapist from contacting you after they leave the agency unless they don't have access to the portal. But on their way out, I don't know. It sounds weird, right?
It's not that hard to find people.
Right on Instagram or Facebook or something.
Yeah.
And presumably the therapist would, on their way out. But I don't know, I could see a scenario where all the records are on the company portal.
Yeah.
And the therapist is just shoved out the door. I mean, that happened to me at my first job.
Oh, right.
I was fired from my first job, my first internship as a therapist. And I've been over this before, and I write about it pretty extensively in my book on supervision.
Great book.
Thanks. You helped. And I'm 25, 26.
Yeah.
And I don't know what I'm doing. And I'm just learning. I was fired after 8 weeks.
Yeah.
And I'm pretty sure that after 3, it was decided that they were going to fire me. And nothing happened during those first initial weeks that anyone would say is grounds to fire an intern. I was green. I knew I was green.
Yeah.
I ran into him years later, and he said that the whole agency was going through a lot of chaos, and I was just part of the collateral damage, just the way that I would put it, I guess. So what happened was, in the final supervision meeting, as he is handing me this letter that has all these allegations against me, which were all unfounded.
Oh my God, how awful.
Yeah. I've been over this before, but just to give you one idea, like the one that really stuck out to me was that, well, there were two. One was that I was making coworkers feel uncomfortable, and it was a large agency, and they all knew each other, and I'm shy.
Yeah.
I'm a reserved person, and I just wanted to not get in other people's way.
Yeah.
and I wanted to be a good therapist. I was terrified.
Yeah.
And so I was just being quiet. But again, we're talking about the first 5 weeks of being an intern.
Oh my God, it's so much newness and holy
at an
cow.
agency that has a very tight-knit group of people that
Right.
know each other in and out of work.
Yeah.
And I wasn't being aggressively shy, you know what I mean?
No.
I was responding when people addressed me, but I
Sure.
just wasn't initiating conversation or speaking very much. But anyway, so I was told that. The other thing I was told was that I had an unethical approach to treating people with addiction because my supervisor asked me what I would do with someone that was in the throes of some addiction.
It's such bullshit.
I know. And I said, well, I've been told that we're supposed to terminate with them and tell them to get treatment because it's hard to treat someone that is in the throes of an addiction.
Right.
But I've also heard that there are other points of view, but I don't know because I'm 3 weeks into being a therapist. And so
What is this, a pop quiz?
So I literally remember asking my supervisor, well, what do you think? And I remember him not giving anything. And I remember thinking, that's weird, but he's the supervisor.
Yeah.
So I should just take this for what it is as a normal representation of supervision.
Right.
And I was getting this constant sense of a threat with him.
Ugh.
To the point where I would have to meditate for like a half an hour before supervision. Imagine that. Imagine having to do relaxation exercises before a supervision is supposed to. That's why, so I start the book on supervision on this anecdote because I want to contrast the rest of the book with my experience, which is supervision is supposed to be one of the deepest, most caring, most guiding, most mentoring relationship you would ever have in your life in any context.
Yeah.
And for someone to be this, not only just not a mentor, but an antagonist.
Yeah.
But anyway, so in this meeting, he's telling me all these things. And I'm like, okay, well, I guess I'm fired, right? He's like, yeah. And I'm like, well, I don't know what I said, but I said, well, so I'll have to terminate with my clients because I knew enough to know that I needed to say goodbye.
Bravo.
And he said, no, you have to leave right now.
Oh,
right at this very second. You have
dick.
So, and this is before electronic records, so that, unless I had access to the paper file.
Sure, right. You're going to run into the file room and...
Golly, and remembering all this, it makes my hands sweat again.
Ugh, he's such a jerk.
But he's like, no, you have to leave right now. And I'm like,
my God.
I said, wait, I have clients I have a client in 5 minutes. Are you telling me that I can't say goodbye to even that client? He's like, no, you have to leave the building right now.
Oh, God.
And I'm like,
what a dick.
Why? Like, why can't I say goodbye? He's like, that's just what's going to happen. I'm like, my God. And that really tells you something, right? That like, because even if I was this horrific, unethical, harmful therapist, at the very least, you would, as a supervisor, myself as a supervisor, would offer up that I would be there for those goodbye sessions, even if they were just 5 minutes long.
Right.
Because the harm that can happen to a client. Yeah. To just have a
what's
therapist.
He thinking about?
Just abandon them.
Yeah.
Yeah. So when Al talks about having a therapist that just disappeared like this, it just makes me wonder what happened.
Right.
It's also possible the therapist might have just decided to leave, but that doesn't sound likely given the way that she was talking about, for 3 weeks. It's also possible that she literally died.
She could have, or gotten sick.
What's so fucking annoying, though, Al from Boston, is that the agency apparently has told you nothing.
Nothing.
Which is
it's unnecessary.
Yeah.
It's like going out of your way to be an asshole.
Someone committed an ethical violation is the thing.
Yeah.
Either the therapist and or the agency.
Yeah.
It's just inexcusable.
Yeah,
there has to be some effort to ethical termination. It's in all of our ethical codes.
Right. And
termination.
It's not common sense. It does not defy common sense to just be decent.
Yeah.
People are...
Yeah, it's upsetting.
Very frustrating.
So, yeah. If you want to, Al, you could Google your therapist and find ways of contacting them.
Maybe they're somewhere else practicing.
But if you're generally in recovery from this, maybe it's best to just continue to move on. But I'm sorry that happened to you. It's upsetting.
Me too.
Up at your patron, Liz, she says, I work as a therapist, and my professor, who is a licensed marriage and family therapist, my professor from grad school many years ago, whom I adored, agreed to work with my sibling individually. So up at your patron, Liz, who is a lovely person. I know her.
Oh, neat.
She is a therapist and has a professor who was an LMFT from the past, many years ago, and she really connected with this professor. And it sounds like she asked him to work with her sibling. And he said, yeah. And so he did. Later, he agreed to see me and my husband for couple therapy. Then he agreed to see me individually. And I think she's also saying her husband individually.
Oh.
And that he saw my parents once as well. Because it sounds like maybe the parents came in for the couple therapy or the individual therapy one time.
Yeah.
But mainly it sounds like that the professor was the sibling's therapist and her therapist and her, Yeah. So thoughts on this, Bob?
Too many hats.
What do you mean?
I mean, if they're the only therapist on the planet, then okay, fine. But it'd be very hard to be, there's a potential of, it would be hard to be the therapist my client needs me to be when they have relationships with my other clients. So I would avoid it. It isn't like guaranteed it's going to cause troubles, but since there are many other therapists in the world that are good and decent and probably connected to both of these folks, it just makes sense to me to keep it cleaner, to just not do that, and just, find somebody else.
Yeah, it is a matter of risk. Is it guaranteed to harm? No, but it raises risks that are avoidable because, as you say, there are plenty of fish in the sea that are just as good. However, it is hard to find a good therapist. And what if your professor, a former professor at that, is one of those therapists that's just one of those special people that just really connect and are able to help people,
Well, I think I know my way around how to be a therapist too, but I probably wouldn't take...
No.
I would not be willing to take the risk.
No. Neither would I.
I think it's okay to be asked.
Yeah. Clients and students can certainly ask, but it's up to the clinician to evaluate it. Yeah, no, for me, I was asked, but would never agree to this for that reason of there's other therapists out there.
Right.
And also, I want to practice what I preach because as a professor and supervisor, I was pretty adamant about certain boundaries being upheld and not indulging oneself, because one of the reasons I would take a client who was a student is to be self-indulgent, because I want to work with them. I don't want to have them go to someone else. I want to be connected to this person. I want to please this person, and that's not a reason to overlook one's concerns about harm to client. And the harm that can happen is that if, like just specifically with Liz's situation, so if we just take it step by step, that she goes to him and says, I want you to see my sibling. And so now the professor, the former professor, I'm assuming that this happened after graduation.
That's my read of it too.
Let's just go with that. That's not a huge leap there, because the sibling doesn't know the professor, and the relationship between Liz and her former professor might be not ongoing, right? It wouldn't be normal because Liz didn't say that the professor was her supervisor or boss or anything. So, if you and I think about professors that we had in the past, those are basically akin to a stranger at this point. In terms of when we would run into them and any sort of Venn diagramming about our lives,
Right.
But there is, a bit of a risk there. But I would say many professors who are concerned and buttoned up about ethical codes would absolutely consider seeing one of their former students' siblings in therapy if it seemed that the professor therapist was suited to that sibling's needs. You know what I mean?
Yeah. I could imagine Colleen seeing, like, say, Ned Farley.
Right.
Yeah.
Yeah.
Great guy.
Yeah. In fact, a lot of my close people in my life, family members, have seen people that I know really well, professors, colleagues of mine. I've probably sent you people that I don't know if I can think off the top of my head. I wouldn't say on the podcast if I did, but I've referred very close people to me to colleagues of mine.
Yeah.
Because I don't want to mess around when I'm referring therapists to someone who's close to me. You know, someone close to me comes to me and says, "Do you have any referrals for this issue for myself?"
Right.
I'm not going to just give them like 5 random people that I kind of know.
Right.
I'm going to give them someone that I'm like, this person's good, you know,
right.
You and like a couple other people on my short list, you know. So yeah, that's pretty normal. Having said that, it's not universal because it depends on their relationship. So I actually, and I've talked about this before, I had a friend who I saw weekly who she had referred her sister to me, and the sister called me independently of my friend and said, "I want to make an appointment." And I failed to ask her how she heard about me.
Right.
And so I had a whole session with her.
Right.
And at the end of the session, she mentioned that her sister was my friend. And I didn't know it until then. This is why it's important that that therapists will ask, "How did you find out about me?"
Right.
Because if it's a situation like this, then it's different, because I determined that I couldn't work with her, and I felt bad about it, of course.
Yeah.
But I said, I see your sister all the time socially.
Socially, yeah.
So, there's too many risks here.
Yeah.
Either you would have to divorce your sister, or I would have to divorce your sister. One of us has to divorce your sister, and that's not okay to either one of us or your sister.
Yeah.
So, and there's no imperative reason as to why you're working with me.
Yeah.
I get that you would reach out to your sister, that your sister would refer me, but I wish I would have asked. I should have asked right up front, and not wasted your time. And I didn't charge her for this session. This was like 25 years ago or something.
Right.
So it's not universal. It just depends.
Yeah.
But then we go on to the next one. Liz is saying that she went to him, it sounds like, and says, "Can you treat me and my husband?"
Right.
Well, now we're looking at a different situation. Mm-hmm. Again, if it's pretty distant as a former professor, it's not as long as there's a firm boundary around that.
Yeah.
How many times would they run into each other socially, like at a professional event? Maybe never.
Right.
I don't know.
What kind of problem dually would that cause?
Yeah. Now, you also have the dual relationship of, well, I'm now treating my client's sister, who also happens to be my former student. Is that going to mess things up?
Yeah.
Because I might have heard a lot of things from my first client about my former student that might influence me in my approach. Say the sister and the husband had an antagonistic relationship.
Right.
Will the husband feel safe with me?
Right.
And, just a lot of questions.
Sure.
But in and of itself, not a problem inherently.
Like automatically going to be a problem. It might be a problem. It could be a problem.
Yeah. But I don't know. When I first heard it, I was thinking similar to you, of just like, too many hats, right? But it just depends on a lot of things. It really depends on that relationship the professor had with Liz. Because as family therapists, we're used to this kind of muddy water.
Yeah.
Otherwise, we wouldn't be family therapists, because even just bread and butter of family therapy or couple therapy, you have a lot of people in the room and a lot of different vectors of alliances or of misunderstandings or something.
Right.
And we're able to handle that anxiety, and it's not a problem. So it depends. Yeah, is what I'm thinking. But anyway, so going on here. I emailed him to ask why there was never an informed consent or an intake paperwork process at all. So it sounds like there was no paperwork, no disclosure, no informed consent at all. So I informed him as to why there was never an informed consent or intake paperwork. Here is his reply. So this is his email back. "It makes sense to me that you would wonder about this. I usually provide it to clients, but I'm thinking there have been times when I have neglected to do so. The reason I don't need a questionnaire or other intake paperwork is because the therapeutic alliance is important to me, and I am able to explore with people what I need to know based on their presentation. I'm happy to send you a PDS and my informed consent. End of his email to her.
Right.
PDS. I'm trying to think what...
Disclosure statement? Personal disclosure
statement? Professional disclosure statement?
Yeah,
Okay.
yeah, that's it.
So I just want to read this again. It makes sense to me that you would wonder. I usually provide it to clients. Okay. And then he says, but I'm thinking there may have been times when I neglected to do so. So just chiming in here, I'm thinking, how do you neglect that? It's such an automatic thing, right? It's like neglecting, I don't know, to unzip your fly before you go to the bathroom. Like it's such an automatic thing. You know what I mean?
Oh, I've been there.
I don't need to remember to do my intake paperwork at the beginning because it's so habitual. So for someone to say, I think there might have been time, like if you had said to me, I think there might have been times when I might have not done the informed consent at the beginning of treatment, I would say, how would you possibly have that thought? That's very alarming. That someone would say, maybe there have been times. How do you forget that? Yeah. Do you know what I mean?
Yeah.
It's like, I think there might have been times when I left my children at school and forgot to pick them up. I'm not sure about that. That's not something that you would hear a responsible parent. It's not something you would hear a responsible therapist say.
Yeah.
I think there were times when I forgot my intake paperwork. What? So then he goes on, the reason I don't need a questionnaire or other intake paperwork. So right there, it's not necessarily a questionnaire. Informed consent is very different from an assessment form.
Oh, yeah.
So the reason I don't need a questionnaire or other intake paperwork is because the therapeutic alliance is important to me, and I am able to explore with people what I need to know based on their presentation.
This is a little apples and oranges.
Yeah. Okay, great. I think what he's saying is that he doesn't want the paperwork to interfere with the development of the therapeutic alliance or the relationship.
Have you ever had that concern?
Well, yeah, it's a bit of a concern because if you spend the first 45 minutes of the first session going line by line over your disclosure statement, then it can alienate a client and make him feel like, hey, I drove all the way here.
Yeah.
I don't really know you. I'm dying to talk about 5 different things. And we
Right.
just spent the whole time going over these dry legalese kind of things. So there's a balance there.
Yeah, balance.
And assessment is similar. If the client's like, oh my God, last week, and then you as a therapist, well, hold on, I have a lot of questions about your childhood or something, And again, it's not going to cause the relationship to bond necessarily. So
that's about not being rigid. Not being, I don't think I ever spent 45 minutes with anybody on a disclosure statement. I wouldn't want to do that. Usually it's 10. But if they came in and they were in crisis, I would skip it. And I would bookmark it for the next time or when the dust settled, but I wouldn't skip it entirely.
Right. Yeah. There's no reason why you couldn't revisit it, especially in the second session.
Yeah.
Now, I do not recommend anybody skip the at least extremely brief process of explaining confidentiality and the bare essentials of disclosures and signatures that need to occur.
Yeah.
So regardless of the pressuring nature of a client's need to talk about something, there's no justification for just breezing past informed consent.
Right.
All you got to do is say, okay, I really want to get, and I don't want to get bogged down in the paperwork, but I need you to consent to treatment before we begin treatment, which means that you're consenting that you understand this, you understand that, you understand this. And so by signing this, you're agreeing to at least that. Later, we can talk about all the other stuff that's on here, but I need you to sign this. Do you consent to treatment? Yes. Okay, you need to sign. There is no reason. That took me, 20 seconds?
Yeah.
So there's no reason why you can't do that.
No.
Plus, a lot of people send the intake forms to the client before they come into the first session.
Oh, that's what I do.
Yeah.
And now it's all email, so it's very easy.
Right.
Yeah.
I imagine that a lot of people, because when you go to I just recently switched to eye doctors, and they have a portal. They have their own medical portal, and there's all these informed consent forms that you have to sign online before you can even make an appointment. It's not hard to do.
No.
Anyway, so that's what he said.
Okay.
And that's a concern. So we see two examples of floppy ethical practices. Now, does that mean harm is occurring? No. It just means risk of harm, especially to his practice. It's a wide open door for a lawsuit, because if anything were to occur, then he has no leg to stand on, right? Like if a client were to be upset that he made a report to CPS, he would have no leg to stand on because he didn't inform the client that was a possibility.
Right.
So it's really not good for anybody, including him. Going on. He gave me the documents immediately, but I feel confused, and yet I don't know what the ethics say, and I've been listening to your podcast since 2016. I welcome your thoughts. End of email. Yeah, Up at Your Patron, Liz has been around a long time. She's an OG listener.
OG.
So the ethics are that, as we discussed already, and if reported to the state licensing board, then he would have a talking to by the licensing board for sure.
Yeah.
Would he lose his license? I don't think so.
No.
But he would be informed that he needs to button this up. And he
probably sent to school.
Yeah. And he probably would. Now, I want to talk about, I don't know if I told you, but another one of my colleagues from Antioch died and got hit by a car. Did I tell you about this?
Yeah, you did.
Yeah, Jerry.
Yeah.
Yeah.
I read about him. Where did I read about him? In the Antioch publication, maybe?
Maybe.
Yeah.
I don't get that. I don't get the Antioch. Why don't I get the Antioch publication? Is there a newsletter?
It's a little book. I think it comes quarterly.
Does it come in the mail?
Yeah.
In the physical mail?
Yeah.
Wow. Yeah, I don't get it.
Yeah.
That's
Colleen,
funny.
Colleen read about him.
Huh.
Yeah.
How do you know they still print out a pamphlet and send it in the mail?
Yeah.
Huh.
And it's not Antioch, Seattle specific. It's the entire,
Huh. Well, so he died a few months ago.
Yeah.
Hit by a car as he was crossing a road in Bellingham late at night, 9:00, not at a crosswalk. So there's all these questions as to why was he trying to cross? He was going to a store. He had parked his car and gone to the store.
Yeah.
He parallel parked and then walked across the street.
Yeah.
And it's a kind of a blind corner. And so you're thinking, was he unaware of the risk? Did the car come around the corner too fast?
Right.
She did stay, the person in the car.
That's good.
Called 911, But anyway.
Poor guy.
Yeah. So I will say that at his memorial, particularly the second one, which was open to a lot of other therapists and professors and clients, actually. Oh. And pretty much, I don't know, I would say 80-90% of the people who talked about him brought up stories of his unethical behavior. So Jerry was loved by people. I cannot tell you how much he was loved by people. He was loved by colleagues, by students, by clients. Students particularly loved him. He was just, he was always smiling, but he was also very real and confrontational in a really aggressive but soft way. It was weird.
Wow, that's an art.
He was a short, slight, very older guy. When he died, he was in his 80s, and he was very soft and very kind, and he saw people very effectively and would remember things about people, and he was a total workaholic. I mean, the guy, as a program director myself, as his boss, there were times when we would run into crises where we didn't have a professor to teach a class. And I always knew I could ask him and he would pick up the slack. He would teach literally twice the amount of classes that was required of him.
Wow.
He would get paid for it, but not a lot,
Yeah, you don't get rich being a professor.
Yeah. And he would meet with students off hours to help them. It was just a very a very lovely, helpful, warm, humorous, approachable, safe person. But the other part of it that I would lament as his boss was that he played fast and loose with boundaries and ethical codes.
Oh.
And now that he's gone and the licensing issue is no longer in question, and the fact that everyone at this memorial, the clients, colleagues, bosses, would stand up and say all the lovely things about Jerry, but then would say, and, he did this one thing. And there were so many things. And of course, I knew about a lot of the things because he was actually disciplined by Antioch at some point because of his boundary problems. He would play really fast and loose with it. And I'm wondering if upper tier patron Liz, her professor, is sort of like this.
Yeah, right.
Where he is this very effective human helper.
Yeah.
And part of that mindset of I am not, because, for me, I'll say that when a student comes to me, past or present student, and they're struggling with something, or I notice something that they're going through, I don't put my all into them the way I would if it was my mom or you or something. I have a little bit of a professional barrier there. I don't completely dive in. Now, I might be very helpful and the student might find me to be very helpful.
Yeah, cool.
But I'm not like completely open and free to act the way that I want to. You know what I mean? And that barrier is helpful when I need to evaluate whether or not a boundary is being crossed and whether a risk is being taken. Whereas I think people like Jerry and like upper tier patron Liz's professor, they might have an approach of like, look, in order for me to really help people deeply, I have to let go of these boundaries. I don't know if that makes any sense, but I've seen that presentation enough times and have been very intimate with the Jerry presentation to know that he was so helpful to people. Mm-hmm. He could turn to you in the middle of a meeting at Antioch and affect you for months with just a small interaction. You know what I mean? He and I never had that relationship because we were more peers. You know what I mean? But anyway, I saw him do that, and I, at the same time, would say, but Jerry's doing all these things about, and Jerry would teach ethics.
That's an irony.
Yeah, I know. On one hand, I think, yes, we need to be professional. Risks need to be accounted for. Clients need to be protected. There are reasons why we have these professional standards and ethical codes. And some of these people are just such a overall good for the universe that whatever kind of corners they cut, it's not a reason to completely shut them down. Now, as I say that, you think, well, can't they be helpful and also just provide informed consent at the beginning of therapy?
It doesn't seem like it gets in the way.
I mean, do you know anyone like this?
Do I know anyone like this? Let me think for a sec.
We didn't really have a professor
not that I know of
that at Antioch when we were there.
No,
that was like this.
No.
But I feel like this was more of a thing in the 90s when we first started out. I feel like we would have heard about this more then. You know?
Think it's like a cultural shift? Like he comes from a different era.
I do.
Because things are much more rigorous now than they were.
Uh-huh.
Yeah.
Yeah. And Jerry would lament that often. He would often talk about how things have become too professional. And I agree with that.
Yeah.
At the same time,
on the one hand,
there are little things you can do as a therapist that will help protect the client, if you're truly concerned about the client.
Right.
So the informed consent thing, I don't get why Liz's therapist wouldn't have informed consent. It's like, what's wrong with you?
Yeah.
But the loose boundaries regarding sibling and couple therapy and that kind of thing, which again, in marriage and family therapy wouldn't necessarily be seen as loose boundaries.
Right.
Certainly some marriage and family therapists would, but not all of them.
Well, he's an LMFT too. I mean, this is his training and background, so who knows? Maybe he views that in a very systemic way.
Right.
So, okay, fine. Does Liz have a complain about him?
She didn't say, she doesn't have any question. She just laid it all out. She just wants our thoughts.
I wouldn't do it. If it were me, I wouldn't do it. I because of the risk, and I'm, in this direction anyways, risk averse. I wouldn't do it, but it doesn't necessarily mean that it is harmful. But I can't see the point to it. Mm-hmm. But I come from this era. Mm-hmm. So, maybe that person comes from, a bygone era and has a different mindset. Probably does. Mm-hmm. Yeah.
Yeah. The other thing I'll say is I can't guarantee that Jerry didn't harm people.
No.
Because I wasn't aware of every interaction that he had.
Right. Of course not.
And I could see someone having been harmed by Jerry having a really hard time coming forward because of the overall love that was constantly being expressed about him.
Yeah.
It's just
it's a possibility.
I don't know.
And it would be a quiet tragedy.
Yeah.
Yeah. Because mitigating risk doesn't mean that you ace out the potential to harm. It's just, in my opinion, a good idea.
Yeah. But even, but what I'm saying is like with Jerry, he, in my view, was taking a lot of risks.
Yeah.
And could have resulted in harm as a direct result of that taking risk, Do
you think any of that's ego? Like,
I think some of it was for him.
Yeah.
But I also think he genuinely just cared about human beings. I mean, he put so much effort into helping everyone around him. I mean, there were so many, because him and I were very close because in my program for a good number of years, it was just him and me and Paul.
Wow.
You know Paul David.
I do.
So Paul was our boss,
right.
And he had 2 employees basically, and it was me and Jerry. And we were in charge of, 150 students.
Jeez, I didn't know that.
Yeah.
Wow.
Yeah. Now the MFT program is like
what?
15 full-time professors or 13 or something.
Do they still have a lot of adjunct people?
Additionally, they have a lot of it, but the ratio is far lower. In the past, it was a lot of adjuncts.
Right.
But for us full-time professors, it was up to us to do everything.
Yeah.
To advise, to interview,
right.
To change policy, to interact with other systems, to market. Right. That was kind of my job, and Paul's job was to keep our jobs afloat by making sure that we had a steady stream of new students.
Yeah.
And we didn't have a marketing department back then. And occasionally we would have a marketing department, but it was pretty ineffectual. It was completely up to us to make everyone know that we existed and to drag. Because, marriage and family therapy is always going to be the underdog to counseling because people know about counseling. Not everyone knows about marriage and family therapy. So we were always at a deficit.
Yeah.
We were constantly competing with counseling because, our right across the hallway was the counseling program. And so we had to oftentimes pull students away from counseling. We managed to always be about half and half.
Yeah, that's what I remember.
Right. Which was appreciated by everyone. And even the counseling side was happy to have that, Anyway, so...
Do they still call it MFT as opposed to couple family therapy?
They've always called it couple and family therapy, but the widespread term in our field is marriage and family therapy, and the license is marriage and family therapy.
Oh, interesting.
And technically, the degree is in marriage and family therapy. So it's the couple and family therapy program,
right?
But you get a marriage and family therapy diploma,
right?
So because in order for the diploma to be more readily accepted by the community and by the licensing board, it has to conform to that language system. But it's so fucking stupid. We don't understand that not every couple is married. Like, everyone understands what couple and family therapy is. You know what I mean?
Yeah.
And but there's a further movement that's been afoot for, 15, 20 years that seems to be gaining traction lately, is to get away from the term marriage and family therapy and refer to us as relational therapists or relationship therapists.
I don't like that. I think it's for the general public they won't know what the hell that means.
Yeah. I mean, it's rough either way because marriage and family therapists see a lot of individuals. In fact, anecdotally, myself and all the other marriage and family therapists around me, half or more of our clients are individuals.
Right.
So we're not called marriage and family and individual therapists. We're just
No.
called marriage and family therapists.
LMFITs,
Right.
lymphits.
So
It's funny because, my background's in counseling and all I do is couple
see couples,
therapy.
yeah. So it's a problem either way. Relational, at least, especially if it was advertised
Right.
better, which I don't think would ever happen, then it would be nice if the public had this term of, oh, you sounds like you should go to a relational
Therapist, yeah.
and then they know to
Right.
come to us, because not only would we assess whether or not everyone should come into the office,
Right.
but even if it was just an individual, we would have the expertise to help them
Yeah.
with their relationships.
Right.
Now, counselors can help people with relationships, so I don't know. It's
Yeah,
just-
but I have to tell you, before I got training, I would not have done a good job with that.
yeah.
Even in my thinking, which is individually oriented, misses the boat with attachment and seeing a person in their greater context. That was not part of my training,
Yeah.
and a really golly an important thing to learn.
Yeah.
Like a essential
Yeah. Wow.
essential thing to learn.
You're a true convert.
Don't tell anyone.
All right, let's take a break and one more email after that. What do you say?
Right on.
All right, back from the break. Anonymous middle tier patron, she says, "Dear Kirk and Bob, is this a wrong reason? Is this a wrong reason to want to become a therapist?
Oh.
I have a concept that psychology is the root of everything via the relationships we create, which create systems like family, government, society, etc.
Wow.
And that by pursuing this career as a therapist, I will finally have a grasp at humanity in general. I want to be able to read and pick up people's behaviors and deconstruct what they are saying underneath. I also want to learn how to communicate in a way that people will understand and will know why. I want to know why they act the way that they do. Am I being too idealistic? Is all of the above possible? Bob, what do you think?
I think this is lovely. This is a great reason to be a therapist. I just spent the weekend taking this training called Psychobiological Approach to Couple Therapy, and much of what was talked about from a theoretical point of view is akin to what this person wrote in and said about people as individuals in systems, and also that it's all created. Like we create, like relationships are abstracts. They don't actually exist except that we say they do.
Yeah.
So, and they clearly are coming from it from a humane kind of point of view, where they're interested in well-being and welfare, not like, treating zoo animals. Like,
Or being a marketer or something.
right. So yes, I think this would be a great reason to be a therapist.
Yeah. Well, but specifically what she's saying, I think, is she wants to understand people in her personal life.
Well, fuck it. Yeah, why not?
Yeah. Yeah, absolutely. I think that it's fine. I think if you pose this question to people in the public and maybe people in our field, they would poo-poo it on some level, because I don't know, it to some people might sound manipulative or something, or unrealistic, but it's not unrealistic, and it's not necessarily manipulative.
No, I don't think that either.
Me personally, I am very, very happy that I entered this field and have strived to learn to learn about all this stuff, and it has helped my personal life. I mean, just one thing that it did immediately was I was halfway through psychopathology with Ned Farley. Were you in that class with me?
I don't think I was in that class with you.
Did you have psychopathology with Ned?
That does not ring a bell.
Ned is still a friend of mine at Antioch, by the way. He's
Dual relationship. What's wrong with you?
he's in the PhD program now, but anyway, he talked about panic disorder, because that was the chapter we were going over, and I suffered from panic disorder.
Oh, right.
And learning about panic disorder completely, I would say, took away the problem 98%, like just basically overnight.
That's fantastic.
After I understood what panic disorder was.
Hey.
I didn't know that was even a thing.
Yeah, right.
Prior,
Why would you?
know? Yeah, this is before the internet or anything, so
Right.
I didn't know. And I remember reading this line, and it might even be in the DSM, of that the individual will feel as though there's this impending doom, but they won't necessarily be able to identify what the danger is exactly.
That is very insightful.
Yeah, and not every panic disorder will manifest this way, but for many, it will. And it was for me. And when I read that, I was like, what? Oh my God, that's exactly. And I wouldn't even have been able to articulate it,
Right.
Anyway, so that's just one thing among thousands of things that I've benefited from learning about all this stuff.
Right.
And it's a huge benefit. The question, though, anonymous military patron, is do you actually want to do the work? Because it's wonderful to know this stuff and have it available to you in your personal life and your relationships, and just to get a grasp on, like, why do people and systems work this way? It's another thing to be sitting down for 40 hours a week and actually doing therapy work, you know? And I've seen a fair amount. It's a new phenomenon over the last 10 years of increasing general awareness and interest in psychology, which is great. But I see an increasingly greater number of prospective students and students who will enter my program who, after a year or two, will discover, I don't think I was ever really wanting to do clinical work. I was just really interested in psychology.
Right.
That doesn't mean it's a waste of time.
No, not at all.
But it very well might be a waste of time and money.
Yeah.
So you just have to ask yourself, in addition to this, and maybe more fundamentally to your motivation, do you, anonymous military patron, have a deep calling to help people, to get into the thick of it, to get your hands dirty and sit down for 7 hours a day with 7 different clients and get into things that are chronically difficult for these people that will not change very quickly, if at all, in the time that you work with them?
Yeah.
Do you have a desire to, problem solve, or to help, or to provide corrective experiences, or to validate, or to delve into, to listen? Is this something that you have a calling for? Is this something that is a gravitational force on your life? Otherwise, I don't recommend pursuing the career. You can certainly go to school and get a graduate degree, non-clinical. In fact, at my university, we offer non-clinical masters.
They do?
Yeah. You can take all the classes. It just, at least last I was in charge of this policy, it was this way.
Oh.
That you could take all the classes and you just wouldn't do an internship.
Oh.
And you'd have what we called a non-clinical master's degree. So
that's cool.
It wasn't set up for licensure because there was no practicum, but you did graduate with a master's degree.
Have a master's degree.
Yeah, and you'd have to replace the missing credits in the internship with other electives, which, a lot of people really enjoyed,
Yeah.
You can move on to a PhD from there, or just use the degree for understanding something so it can help you in another field, like in environmentalism or politics.
Maybe you want to be a medical doctor or something.
Yeah.
Yeah.
Right. All right,
Bob.
Bob.
The thing that keeps going through my head is that scene from The Matrix, where Neo walks in and the little kid is bending spoons.
Mm-hmm.
And the kid says to him, "Don't try to bend the spoon. That's impossible.
Mm-hmm.
Instead, only try to realize the truth." And Neo goes, "What truth? There is no spoon.
Mm-hmm.
And it is only yourself that bends." I think if this person wants to pursue their training, I'd like them to be open to the fact that they'll be the one doing the bending, not other people around them.
What do you mean by that?
I mean that my training made me humble, and continues to, and should. Because understanding is a pathway towards empathy.
Mm-hmm. Not the side of, ooh, I'm going to be able to figure other people out, is I'm going to be able to figure out for myself and adjust to other people better.
Yes.
Yeah.
And as a result, I think this is true, be in a position to be more helpful, not less.
Right.
Yeah.
Do you think about that in session with clients as you're trying to get your client to do something?
On my best days, yeah.
Yeah.
Yeah. I was thinking about this yesterday whenever I don't remember all the context in which it came up, but the ways in which I find myself going after one person in a relationship which never works. Might be understandable that I get hooked, but never works. And how it generally represents a failure in empathy. Like, I am not getting in their shoes and I'm not seeing things as they really are. I've got my axe to grind.
Yeah.
Hey, it's fine. What am I going to do? I am me, and whatever, my body has these responses or whatever. But it'd be irresponsible to not challenge that. Because the last thing anybody needs when they come to therapy is to get in a tug of war with the damn therapist.
Right.
Yeah, so.
It reminds me that there was a comment on YouTube. I'm watching this show called Couple Therapy. Actually, it's called Couples Therapy, which annoys me.
God, that would annoy me too.
It annoys you too?
Oh, yeah.
Right, because you and I come from a time when it was called Couple Therapy. Yeah. It sounds a little weird the first 100 times you say it.
And then
but
it's
after a while...
Are you an individual's therapist?
A family's therapist?
Are you a family's therapist, Kirk?
Yeah. Are you a feet's doctor? Are you a teeth's doctor? Anyway, so I'm watching this show, and it's a series that's for members only on YouTube. And one of the members, so members have to pay to become a member of the YouTube channel. So you have patrons, and then you have YouTube members.
Oh, a similar kind of thing. And
yeah.
And this show's called Couple Therapy. And
it's on Showtime.
Oh, wait, is this the lady in New York who does couple therapy?
Yeah.
Oh, yeah. A couple of my clients have told me about it. Is it good?
Yeah. I think it is. I'm glad it exists. So I'm supremely glad it exists, given the terrible depiction of therapy in the media. But for myself, I'm just watching. This is what I do for a living.
Right. Yeah.
Not only do it, but I supervise, and it's not particularly interesting to me. But it is interesting because it provides me gives me a chance to talk about things for the YouTube people that I don't get a chance to talk about with like reality TV.
Right.
And apparently, a lot of people will say that they like it when I react to it because it helps them to understand their own therapy that they've been in.
Oh, right on.
Because they might be confused as to why their therapist did this or did that. And just hearing a therapist talk about the decisions that we make or the considerations helps them to just feel safer, I think, and maybe able to return to therapy after having a bad experience or something. Anyway, so I'm watching this one couple that everyone wanted me to watch, and the guy cheated on his wife.
No.
And in the beginning of therapy, he's extremely flippant about the whole thing, and it's pretty annoying the way he talks about it. He just is like, "Hey, I was in a different town. What's the big deal?" That kind of stuff. Like literally. Yeah. And so I'm reacting, but I'm also providing a landscape in which we can explore why he would be this way.
Sure.
Right? People don't necessarily wake up in the morning. Some people do, but most people don't, and say, I'm going to ruin other people's lives through my deception and gaslighting or something.
Oh, that was not his intention.
Well, it could be, but there are psychopaths.
Okay, yes. That's the rare case, but
it's rare.
Yeah.
And so I'm exploring. I'm trying to figure out. But to be clear, I was pretty, if he were a client of mine, I would not be saying the thing or even thinking the things that I think as I'm reacting. I'm pretty harsh against him. I'm not like railing.
Well, you're not his therapist, and you don't have to maintain a therapeutic alliance.
Yeah.
And so it gives you a little more license to be frank.
Yeah.
My guess is you're not pathologizing him like some kind of douchebag.
No, but I would say something like, I'd watch a clip and then I'd pause and I'd say, oh my God, that's fucking ridiculous.
Yeah.
Why would you say that? Yeah.
Right.
It's pretty judgmental stuff, really. Yeah. But one of the comments from one of the members, so these are people that are apparently people that might know the channel well enough anyway, me well enough, said something like, it's incredible the amount of coddling that you give men or something like that. That
you give men?
Yeah.
Wow.
Yeah.
What do you think?
Well, I get this from people because a lot of the viewers are women, heterosexual cis women, who have been harmed by men.
Oh.
And I do have a bias that I'm sure presents itself. I don't know which direction it goes, though, because I could see myself actually being meaner to men because I'm a man. And I also have have absorbed the gender associations of our society. And if
Well,
I were to pick a gender socialization that I'm less fond of, I would say the male gender socialization is more problematic in our society.
Yeah. I agree.
So I don't know, but I imagine there are times when I might be able to relate to men better, and it might show in my leniency or something. I mean, I could see that being true for sure.
Oh, okay.
You know, I'm a cis het dude. I've been harmed by women, so in these romantic ways.
Oh, yeah.
So
Right.
that's probably going to crop up now and then.
Do they give constructive feedback, or do they just...
No, that's all they said.
Oh.
So I replied, I said, thanks for the feedback. Do you have a specific example? Because, I didn't want to rewatch the whole episode just to figure out what they're referring to.
Right.
Now, a lot of members were very kindly defending me and being very appropriate. You know, they weren't blasting this individual.
Yeah, good.
They were saying, I've been watching Dr. Kirk for years. I've never thought this. What are you referring to exactly?
Right.
So there was that. But I just am bringing this up because, why am I bringing this up? Because
Let's see.
You were talking about
Matrix.
Oh, you were talking about going after one person.
Oh,
in the couple.
yeah. This does not work.
Yeah. And I felt it necessary to bring this up, I think, because my thin skin is thin, but I feel like it's getting better, but I'm still a little thin. And when I read this comment, it stuck in my craw.
Yeah, I bet it would, yeah.
It was really great to see people, defend me is one way of putting it, but also they weren't blasting the person. They were just like, that's not my experience.
Yeah.
Those are the kinds of defending comments that I appreciate. It's just like, well, that's your experience. That's not really mine.
Right.
I'm curious as to what's going on. Or,
Right.
We could talk about this, or, I'll think about, or whatever, just instead of the typical Twitter sphere where it's just, these exaggeratory ad hominems.
Sort of a troll, anti-troll kind of.
Yeah, right.
Yeah.
Right. I guess, good point. It's like you got the trolls, if we might use a broad definition of troll, and then the anti-troll response can be just as toxic and weird. And so.
Yeah, I agree with you. That's lovely.
But anyway, so when I watch this show, at times I am kind of going after him. But I also, knowing what I know, tried desperately to hold on to the perspective that there's a reasonable reason for this unreasonable behavior.
Yeah.
For those who are watching me watch this series, it takes me a while to get through this couple because it really touches on a lot of things. So you'll just have to keep tuning in as a YouTube member to see how that all plays out.
Oh, there's the benefit of lots of your wisdom, huh?
No, in terms of for the client, because I'm watching him in therapy and things progress is the point.
Yeah.
And,
right. Got it. Yeah.
Yeah. So let's adjourn there, Bob.
Sure.
Thanks for joining me.
Yeah, it's been a while, right?
Well, it's been a while for you and me.
Yeah.
But it hasn't necessarily been a while for the listeners, because there probably was an episode of yours published last week.
Oh.
But for you and me, it's been like, I don't know, maybe like 5 or 6 weeks since we recorded.
Right. December, I think.
Yeah.
I had plumbing troubles.
Yeah. But that December recording will be published in February.
Seriously?
Yeah. And this episode will probably air in February.
Wow.
And so people understand it's a couple days before February right now.
You know what's funny is, like, I get a note every day about what your new content is.
Yeah.
And so when it's one of you and me, I'll look at it, and sometimes I'll listen to it, and I can't remember saying anything. I can't. Colleen's like, "How was podcast?" I don't even remember. I'll go home today, and she'll be like, "How was it? What did you talk about?" And I'm like, "Listener emails."
Yeah.
But I don't remember.
Yeah.
You're gonna have to listen to it, babe, because I don't know what the hell we talked about.
Yeah. I will do a deep dive and rerun it. I'll because Stacy will rerun these episodes, and I will see the title of the episode that's published, and I'll not remember a single, there are so many times when someone will be like, "I'm trying to find your deep dive on, this topic." And I'll say, "I don't think we did a deep dive on that." And then I Google it, and it turns out we did. And I'm thinking, what?
Yeah. It's 17 hours on that. I can't remember one of them.
The thing that I tell myself, because it's a very similar feeling to being a therapist.
Yeah.
I remember we've talked about this before. The first maybe 5, 6, 7 years of being a therapist,
Right.
if you had asked me about any client,
Right.
I would have remembered enough, if not a lot,
Yeah.
about those people,
Right.
the way they looked, their issues, There was this point though where it wasn't like a graduate, because you would think, okay, I have 300 slots for clients.
Right.
And if I have 5 new clients, then 5 of the old ones, the memory has to be dumped.
Uh-huh.
That's akin to a hard drive, right?
Right.
But we're not hard drives.
No.
And I think the way that memory works is that there comes a point where you just keep shoving memories in, because you can't delete memories, right? Mm-mm. And once the memories get to a certain density, you lose all specificity around any individual memory.
Yeah.
And so there was a point where I remember thinking, this is weird. I mean, last year, if you would have asked me about clients, I would have remembered every single one. Now, I can barely remember clients I saw 2 weeks ago.
Yeah.
What is happening?
Right.
And with podcasting, if you had asked me after 500 episodes about any one episode, I would have been able to tell you. But at a certain point, the memory became so densely packed that I can't remember any particular episode at all.
How many have you done?
Well, if you count all the videos, it's like 4,000 or 5,000.
Wow.
So, but in terms of audio, it's, but I haven't looked at it. I think it's like 1,500 or something. Oh. Let me look. It is 1731.
Wow.
I was off.
Those are published, because then you got some that are, pre-published.
Well, I've taken a fair amount down. But we've recorded 17, well, in terms of today anyway, at the time of this recording, we've recorded over 1,700 episodes.
That's amazing.
For the audio podcast, yeah.
When do you get the high score?
Yeah. So sometimes I listen to the reruns to reacquaint myself with what the fuck was I said. I don't even remember anything I said. Yeah.
Oh, that was a good one. Or I wouldn't say it that way.
God.
Yeah.
There are many times where I cringe. Yeah. All right. Well, that is for that. Oh, Bob, I have a lot of gifts for you.
Oh.
So this is from Fema. She takes pictures of actual astronomy objects.
Oh.
And she printed, this is, I believe, a globular cluster that you're looking at.
Thank you, Fema. Oh, that's so cool. I'm going to hang that
in the back. That's a great little note.
did. It says, for Bob, because he is a star. Thank you, Fema.
And another
that's really cool.
picture of a star, and you can see the dark spots of the sun.
Ooh.
And there's a longer note in the back, but you don't have to read it. But you can if you want to. Might as well read it.
Yeah. Bob, you're such a warm and kind person, and you sound like an amazing therapist. Thank you. Out of all the therapist co-hosts, I resonate with you the most. I found your voice so comforting. It's like you soothe my soul when you talk. You are warm like the sun. So this picture is for you, Fema. Thank you, Fema.
That's really sweet.
That's really lovely. Thank you.
And for the record, she sent astronomy pictures for all the co-hosts, but she sent 2 for you.
Wow.
Here's a little card from someone else.
Thank you, Caitlin. I will read this after we're done recording.
Yeah. So that's nice. If you want to send Bob things, physical things, you can send it to the address that is on the website. I believe it's on the homepage of our website. I also got you and Colleen some merch, some shirts.
Oh, she's been asking. Thank you. Thank you. These say everybody loves Bob.
Yeah.
Send one to my mom.
So one's for you, one's for Colleen, and then I got you a Psychology in Seattle shirt for you or Colleen.
Oh, thanks. Colleen rearranged my... Oh, yeah, that's nice. Colleen rearranged my closet, and there's a pile for podcast shirts.
Oh.
Yeah, there's blank T-shirts, graphic T-shirts, white T-shirts, long sleeve shirts, and Psychology in Seattle.
How many Psychology in Seattle shirts do you have?
5, 6.
Oh, really?
Like yeah.
Huh.
Oh, now like 8. I guess I have to share these, though.
But, everyone loves Bob. You got to have one of those, and I can't wait to see Colleen wear that.
I'll be heading home a little later, and maybe she'll put it on.
Well, what I can't wait to see is you wearing it.
I don't know, dude.
You have to.
Yeah, okay.
And you are the master of the silly T-shirt.
Oh, God.
You've worn some really silly T-shirts.
Yeah.
I feel like your silly T-shirt game has been lost to history. You got to bring that back, man.
Yeah, no, I actually wear mostly blank T-shirts nowadays.
Yeah.
Yeah.
You never wore blank T-shirts in the past.
No.
They all were
something
You had your own silly T-shirt business.
Oh, I did. That's right. Yeah,
You printed.
Yeah.
You silk screened.
Yeah,
physically.
That was fun.
Your own patented joke shirts back when that wasn't really a thing.
No, that was fun. That was a great learning.
How many shirts did you? I remember you sold them on Capitol Hill.
The T-shirt. Well, they sold them on sort of like consignment. Like if they sold one, then I'd get a cut. And they didn't sell.
None?
I mean one or two maybe, but I don't actually remember ever getting any money for them.
Do you still have boxes of?
No, I don't know where they went.
Chucked them?
Yeah, I don't even have one for myself.
Oh,
yeah, it's just kind of funny because they were fun. I could get them printed again.
Yeah,
but that was cool. Learning how to silkscreen, that's a lost art, I think, or at least for a lot of, because you get those iron-on transfer thingies.
Yeah, it was such a punk. I mean, you weren't doing it in the punk direction, but for me in the late 80s, early 90s, it was such a punk tradition because you would not find shirts of your things that you actually liked. If you had a band that you liked but wasn't very popular, you couldn't find a shirt. So there was this underground movement to make your own. The zine culture. Do you remember this?
No.
The magazine or zine.
Zine, yeah.
And all these, I don't know if it's the right word, but sort of punk artists would go to the 7-Eleven Xerox machine and print out, so you would hand draw all these zines, right? And then maybe type out but collage, and then you would go to the Xerox machine at the 7-Eleven and pay a certain amount of money and run off a bunch of these zines. And then there was this way of just folding the whole thing in half and stapling it, and it was a little booklet.
Yeah.
And you would pass these things out. This is before the internet, so it was the only way that you could share anything. And it felt so adult or mainstream because you were publishing something.
Yeah.
You had a physical copy. You were in league with actual publishers, but you were just by this Xerox machine at the 7-Eleven. So when you were making those T-shirts, it felt that way to me. It was this underground movement, not appealing to the corporate world. It's like, I'm just going to make my own fucking shirts. Yeah. And I'm going to make my own jokes and I'm going to sell them.
Yeah, that was fun.
So, and I have one more gift for you, Bob.
Golly.
It is your own cup.
Hey, my cup. Oh, good. Thank you.
So you left that cup probably 5 months ago, and I washed it.
Thank you.
And then Stacy put it in the cupboard, and it just got lost. And then I recently found it. Actually, I found it 6 weeks ago, but we haven't podcasted.
Yeah, it's been a minute, right?
So I've been waiting to give it back.
Thank you.
You always come here with a Starbucks plastic cup filled with a latte or something.
Yeah, usually, yeah.
And I wondered, since I hadn't seen you come with a latte, if you were waiting to get your cup back. Did you even know you left
I forgot it. I mean, I knew the day I forgot it, I knew I forgot it, but then I forgot.
You forgot that you forgot it.
Yeah, I did. Yeah.
How does it feel to have it back?
Oh, it's like my baby.
Did you get another one?
No, I've been drinking hot lattes. This for ice ones, hot lattes through the winter. So.
Oh.
Yeah.
Oh, it's a summer thing, that guy.
Yeah. But it's getting warm out.
How many ounces? Is that like a 20
ounce? No, just 20 ounces. It's double wall, so it's a little misleading. But it's 20 ounces, and a venti, as they say.
Yeah. That's the end of the episode. See ya. Everyone take care of yourself because
you deserve it.